Good morning, everyone, and welcome to part 2 of WorkCover Queensland's mental injury webinar series. My name is Eve Faulkner. I'm the Head of Communications here at WorkCover, and I will be your host for today's webinar. Before we begin, I would like to take a moment to acknowledge the Yagara and the Turrbal peoples as the traditional owners of the land on which I'm presenting from today, and thank their elders past and present for an ongoing connection to land, culture, water and community. And we also draw inspiration here from their traditions of connectedness and empathy, because today we're going to discuss ways of fostering healing and support in our workplaces. Given the topic of today's webinar, we'd also like to acknowledge those with lived or living experience of mental ill health or distress, and also their support networks. If you do find any of today's content distressing or triggering, we very much support your decision to prioritise your wellbeing and self-care, and rejoin us when and if you feel able to do so. Those of you who were at last week's webinar would have heard me talk about the flannel flower that you'll see on the screen here. The flannel flower is an incredible Australian native flower that symbolises resilience, gentle strength and hope, and it's a symbol we use here at WorkCover when we're talking about mental injuries. I've got some housekeeping to jump into first, and we will record this session, and later on we will send a link to the recording along with the slide pack and a short survey to gather your feedback. The recorded sessions will also be uploaded to our YouTube channels and on our social media. Please feel free to submit any questions during the webinar using the Q&A button in the toolbar of the top of your screen. We'll do our best to answer the questions at the end of the webinar, and we'll also be addressing some of the great questions that came in through the registration process. So thank you to those of you who submitted. We are unable to answer any policy or claim specific questions, and we encourage you to contact your relationship manager if you have one, or your customer advisor handling your claim if you have any specific questions. If you have any technical issues, please refer to the help information under the More button, which you'll find in the toolbar at the top of your screen. And lastly, I would like to remind you that any information provided today, including in response to questions by WorkCover or by our wonderful guest speaker, is general information only and shouldn't be taken as any legal or claim specific advice. On to Dr. Mary. Wow, how lucky are we? We are joined today by Dr. Mary Wyatt, who is an occupational physician who's active in policy development and research through the Australasian Faculty of Occupational and Environmental Medicine and other organisations. She has worked in injury management for decades, including running an early intervention case management approach across several medium and large employers. Mary's other roles include providing IME assessments, running returntoworkmatters.org, completing research of return to work for Safe Work Australia, teaching via Monash University, and various scheme reviews of return to work and claims management for policy makers. And yet she's made time in her day to join us here today. She's also the co-author of RACP's It Pays to Care policy, which she'll discuss later on in the session. A very warm welcome to you, Mary. Before I hand over to Dr. Mary, I do want to take a moment for those of you who were able to join us last week of part 1 of this webinar series. And if you haven't, it is available on our YouTube, and we'll include the link in today's session. In part 1, we were privileged to hear from Dr. Deborah Simmons, who shared her very personal experience of navigating a workplace injury, mental injury, and the critical role her employer played. We have had some amazing feedback following that session from employers talking about how it was a great reminder of the critical role that an employer has in return to work. It was a great lived experience piece of the puzzle, and now I would like to hand over to Dr. Mary to talk to us more today.
Thank you very much for that kind introduction and the opportunity to chat today about caring for people with mental injury via the workplace. I'm not a psychiatrist, so I'm not a specialist in mental health, but I do know a fair bit about how employers can help or can hinder health outcomes, recovery, return to work outcomes after an injury, physical or mental. Next slide, thanks. So I'm going to talk today a little bit about the importance of the role of the employer. It really is a key aspect of return to work and the level of support and approach by the employer has a massive impact. I'm going to talk a bit about the workplace systems that are effective. We talk a lot about, or there is a lot of talk about person-centred care these days, but person-centred care only really comes about when you have good systems in place that make sure everyone is well taken care of. I'm going to talk a bit about the case for psychosocial care, and that applies whether it's physical or mental health claims, and just a little bit about communication. Next slide, thanks. So let's start off by talking about the role of the workplace. Next slide, thanks. So this is data from the Return to Work survey. Many of you won't be familiar with this. This is a survey that's been undertaken since the mid-90s of people who've had an injury. And it asks people around the country about their return to work outcomes and their return to work experiences, perhaps the things that might have influenced them. I was in the fortunate position of analysing this data for Safe Work Australia some years ago, and this is really showing you some of the results to try and highlight the influence of the workplace. This is a slope graph. It's a kind of chart that's designed to highlight the difference between 2 points. So workers are asked in this survey about, did your employer try and find suitable duties? Did they try and support you? A bunch of questions like that. And then a bunch of questions about case management and their experience with case management, and then about healthcare, etc. And what you can see here is when the worker has said their employer has responded constructively and positively, that's my, just using different words, or through this compilation of questions, look at that return to work result. So 87% for a physical injury case when the employer's been constructive versus 62% when the employer's not been constructive. And here we go for psych cases. It's the same, except we know that psych cases generally take longer and have less good outcomes. So same thing, really important response by the employer. Being constructive response, 52% higher return to work rate. Next slide, thanks. Now, how many people say their employer is constructive? Well, about 73% at this stage said their employer was constructive. The most recent survey was in COVID times, and it's probably a bit of a glitch. But 73% of people with a physical injury claim said their employer was constructive. But look at the psych cases, 31%. That's a huge message just to start. Employers deal with physical and psych differently. And we probably know some of the differences. First of all, is it an accepted claim? Should this be reasonable management action? So there's kind of a greater level of disputes with physical cases. But more than that, often employers are just not sure what to say. We've all heard this so many times over. When somebody's got a mental health problem, how do you approach them? Do you back off? Do you jump in? So anyway, the short message is employers treat psych cases differently. Next slide, thanks. Here's just some data about making contact. So simple thing. So the employer makes contact early with a physical case. So there's a reasonable number are making contact early. When they make contact early, then you've got better return to work. And same again with the psych. It's even more dramatic. So making contact pays off. Being constructive in that employer's lodgement of a claim or report of injury makes a big difference. Next slide. So previously I showed you who made contact. Now this is who's making contact early. And we see that contact early is less likely also with mental health claims. Next slide, thanks. It's not just the workplace. I want to show you that other parts of the scheme and how people are influenced more generally also has an impact. So here's case management. And so we see that with physical cases, the case management, the quality of case management makes a difference. 26% higher for physical cases, so not nearly as much as the workplace, but still a notable impact. And then a little bit more for psych cases when the system interaction is good, but nowhere near the same as the workplace. Next slide, thanks. Early assistance. There's questions in the Return to Work survey. Just a few more slides about the Return to Work survey. Early assistance. So there's a question in there about, did your employer try to help you before you lodged your claim? Once again, we see employer support improves return to work, but once again, we see that early assistance is even more important for psych cases. So if there's early assistance, 33% higher return to work in psych cases. Next slide, thanks. Who gets assistance before lodging a claim? Much more likely in the physical space than in the mental health space. So people with a psychological claim, mental injury claim, are much less likely to get assistance from their employer. Is it because they're not talking about it? Could be that. Is it because the employer doesn't know how to deal with it? Could be that too. This question doesn't give us enough depth to understand that. Next slide, thanks. So just the last couple of slides about the survey. Claims that are lodged early have higher return to work rates. Once again, we see that psych cases are less likely to be reported early, and they're likely to have lower return to work rates. Next slide. And again, this is just another way. Before I showed you the early contact, but now this is the early reporting. And psych cases are much more likely to be reported late. And we all know, we've all heard the story of somebody who's got perhaps a stressful situation. They try to put up with it. They try to manage it themselves. Maybe they just, maybe they might go and have a counselling appointment. They might talk to a friend. But they're much more likely to lodge their claim late. People often need to get to a point where it's just not working and they can now see it's not working until they lodge a claim. And that's often many months for a sort of a low-key stress situation, or even a PTSD situation, because it often takes people a while to work out their head's not in the right place. So next slide, thank you. So the disputes, twice as likely to have disputes in psychological cases, and they're more likely to need assistance with dealing with a dispute. Return to work is much less likely if you've got a dispute. In some jurisdictions, I know they're looking at different ways of dealing with this issue of disputes. So my understanding in New South Wales is they're starting to say actually reasonable management action is being overused. And then by the time you've gone through the dispute, things are kind of really hard to repair and bring back. And so they're saying we should be getting in early. Australia Post, who's done some really great work with early psychosocial care, is now getting in straight from the beginning in terms of their rehab and early return to work with psych cases, and just ignoring the dispute. They might be spending money on that rehab and return to work. And then if if the dispute is held up, they might deal with it in a certain way. But they're getting in early and they're really happy with getting people back to work just by putting the dispute to the side, getting stuck into that early supportive care and rehab. So that is definitely worth thinking about. And there's a question somebody submitted about, employees seeing what their employer says about the claim and, any concerns about the employer might have that the claim should be disputed. That probably adds another layer of complexity to it. So next slide, and I'll just skip this slide. And they're the questions. No, keep it on this slide. So there's the questions that people were asked about employer support. So they're not rocket science stuff. It's not complicated, sophisticated help. It's that the employer cared. And, it was wonderful to hear some of Dr. Deb's talk for the first part of this mental health series about how much difference that made to her when she had a case manager caring and her workplace caring. And that's what we're like as people. We really want that. I was in general practice a few decades ago and in the 90s. And I remember one survey of patients, what did they want from their GP? And it was like, number one, they want the GP to care. Number two, they want the GP to care. Number three, blah, blah, blah. Down to about number seven, they want the GP to be running on time. And the last one was not charged, or the second, this was a while ago when it was less expensive, but they didn't want the GP to charge too much. People really value being cared for. It makes so much difference, particularly at a difficult time in our lives. And we all go through difficult times. Most of us go through difficult times in our lives. So I can't stress enough to you the importance of just that general. It's not clever. It's how you communicate. If you do care, that just shows up in all your ways of communicating with the person. So fairness, contact, respect, help. Next slide, thanks. And this is just the last thing I'll show you to emphasise all the things we looked at in the Return to Work survey. Here's us medicos. Physical cases where we make a bit of a difference, but look at all of this: claims, personal resilience, workplace culture, response to injury, all have a much greater impact. So this is the improvement in return to work with a positive response and the improvement for psych. The sample size here was too small, so there's no result about what difference healthcare providers make. Next slide. Now, last thing to tell you about is different data, but the role of people at the workplace versus us healthcare providers. Because we write on certificates about whether a claim, the person has a capacity for work or not, people think we as healthcare providers have a bit of a powerful role in this because we're the sort of designated decider. Well, I'd like to tell you that we're not really the designated deciders. It's the patient who is the designated decider. What you might term your worker or what the system might term a claimant, but we do not have the influence that people think we do. We do make a difference in the early stages where medicine is more important, but once we get beyond that 6 months mark where psychosocial factors dominate return to work, a non-stressful encounter with the return to work coordinator, which just kind of means a good interaction, double the odds the person was back at work. So we healthcare providers come nowhere near that. So you've got such a opportunity at the workplace. Some other things for those who work at the workplace, return to work coordinators, depends, call various things across the country, but return to work coordinators want more training. And so this is fantastic that WorkCover Queensland is providing so much material for you guys to support your development, your professional development, your effectiveness, your efficiency, etc. And traditionally, 2-day training courses for return to work coordinators have been legislatively heavy, but it's the soft skills, the interaction with people that make the difference. Next slide, thanks. So let's talk now about some of the workplace systems that are really important to get good care. Now, if you've got these in place, and this is the same for physical and psych cases, if you've got these in place and you're looking at early to attend to these things, then you are much more likely to be able to give that person-centred care, that care that helps people feel supported and makes them more likely to come back to work. So let's run through some of these. Thanks. So injury reporting systems are a key opportunity that I see missed a lot of the time when I'm seeing patients. And I'm not specifically talking about Queensland or psych cases, but this applies just as much, if not more, for mental injury cases. So we want reporting to be easy. We want it to be personable. We wanted to be able to start conversations about what that person needs and about recovery and return to work. And we want that to be able to allocate to cost centres so you know where your problems are. And we want it to share the right information with the right people. So what does that? Well, you can fax in an injury report, pretty impersonal. There's no person on the other end. Kind of, it gets into a system. It might be ordered as a priority. You might be electronically lodging a claim, same sort of thing. It might be a report to supervisor as your standard practice, which might work well, but might not work well. We all know that supervisors are under the pump. They're dealing with 15 things. They're having a bad day. So-and-so's on leave, 2 staff down, and they have an indifferent response to somebody talking about their injury. We can't blame them for it. It's hard. So we want good systems so that this is avoided. I see people all the time and they'll tell me about the supervisor response, and you can just see the trajectory starts from there and on it goes. And unless there's some good processes to remediate that, it's the beginning of a long-term trajectory. Some options like injury reporting by phone, so that it's really easy for the person. We used to do it and we'd have the supervisor and the worker there together, so you could start conversations with them. Injury reporting systems are the first part of a number of other things that can impact. And these are on the left, and I'll gradually talk a bit of those through. So return to work coordinator skills, supervisor response, senior management engagement, and health of workers is the key, needs to be a central priority. So next slide, thanks. So supervisors find dealing with return to work difficult. If there's surveys done, I was involved with a study led by Venerina Johnson in Queensland, actually asking about supervisor needs and wants for training, and then asking others about what was needed. And, they say good research, it tells what you already know. But one of the things that's really important is helping supervisors. And that said, the same thing as we already know, supervisors want more support, they want more training. If they're trained, you have reduced claim numbers, they're more satisfied, reduced days off work, et cetera, et cetera. And they're in a pivotal position to influence and identify problems as they come up early. Imagine if somebody has a traumatic injury in the emergency department, physical and mental health. And then, it's very easy to be focused on the physical and, I'm talking about a staff in emergency, and it's very easy to kind of ignore the mental health impacts of something. We used a case example recently where, unless you're looking out for it, or the supervisor's watching, we miss these things. So engaging and line managers is really important. Next slide. You can train supervisors in a variety of ways. There can be formal on-the-job training. We've developed some training that could be facilitated by return-to-work coordinators. You can do it just by case studies. You sit around a table and talk about the cases and, upskill. The return-to-work coordinator can upskill the supervisor by talking about the cases and how things can be improved. Just group discussions. Sharing learnings, getting supervisors more actively engaged in managing cases. Next slide, thanks. Senior managers, I think Gold Coast Health has some great examples of getting senior managers on board. And there's numerous examples across industry of once you've got your boss on board, you're really halfway there. Working back in that injury system that was mentioned earlier in the intro, we used to work with, maybe a CEO of a 500-person company, get them to call a worker, Joe, how you doing? I heard you hurt your back. What can we do to help you? That travels like wildfire through the workplace, so everyone knows the boss is involved. But also for mental health claims, you might find that you, as the return to work coordinator, are not the best person to speak to the person to call them. It might be better that's the line manager. It may be more appropriate if you've got a good understanding senior manager to get them involved. So how do you get senior managers on board? You give them what they need to know to manage their role. So their role is to manage finance and overall systems. So tell them about the costs and the benefits. It pays to care really is the truth. If you get in there and do good things, you get better outcomes. So helping them understand that, looking at your premiums. What would happen if your premiums could be down to 0.75% of industry rate or the average, or, rather than elevated? What are the potential premium savings? What are the indirect costs that are potential savings? Show them, we used to use the Victorians have a premium calculator. We used to use that and show the production manager, well, if you manage it this way, this is going to be the cost. If you manage it this way, that's going to be the cost. So speak their language and then tell them how they can lead, leading by example, asking managers, practicing active safety leadership, etc. Next slide. And find out what's happening with your return to work system. So if you don't know how to improve your system, find out, ask this survey, develop one of your own. It's pretty simple. Give this to a worker at a week, give it to them at a month, give it to them at 3 months. You're finding out what's working for them. You're finding out what's working in your system. It helps that case and it helps your understanding your systems for future cases. Next slide. Now I'm going to talk about psychosocial care, and the majority of the data we have for psychosocial care is about physical injury cases, but it seems just as important for mental health cases. Next slide. This is physical, not mental injury cases. But while we're talking about mental injury, maybe we should also be thinking about secondary mental ill health. Because, if you've got a physical problem, a sore back, and then lots of psychosocial barriers, and then you've got mental health problems, then outcomes are even worse than for mental injury claims. So data says that, you've got a broken finger and it heals up okay. You go back to work, plenty of cases just happen. You have an acute stress reaction at work, people are supportive, you go back to work, and really it all pretty well goes smoothly. But we know that a proportion of cases don't go smoothly, much more likely with mental health cases, but also in physical cases. So here's data from the short form of Rebro, a pretty well-known musculoskeletal questionnaire, which asks psychosocial questions. High risk, over 50 score out of 100, 3 times the amount of time off work. Another way of describing this, for every 1 point increase in the short form of Rebro, higher rates, so 4% chance the person will come back to work. We don't have the same level of data for mental health injury cases, primary mental injury cases, but the little information we do have, these seem just as important. Next slide, thanks. So psychosocial barriers are everywhere. They're everywhere in physical cases, and they're also everywhere in psych cases. Psychosocial factors are things things that we all have that impact our lives. You want to go for a pay rise with your boss. Yeah, you're not sure about how your boss is going to react. You'll be like, how am I going to have this conversation? What if they're not going to accept it? Your thoughts, your beliefs, your attitudes, how you approach these things will impact that. You know, how much do you trust your next door neighbour or your sister or your cousin? How you behave will be different with these people. So these are all of our lives, but in workers' comp, there are just so many more barriers and so many more stressors that these things are much more important. So we need to recognise they're everywhere. The two most common ones are workplace issues and challenges with coping in the face of difficulties. And so these are the many psychosocial barriers that people with physical and psych cases face. You know, someone with a psych case might be going through a difficult divorce. And so they're already struggling emotionally, and then a couple of things happen to them at work, and now they're, you know, it's really got them in a difficult situation. So the world of return to work, from my perspective, is the world of overcoming barriers, whether it's at a case level, at a workplace level, or at a scheme or system level. Next slide, thanks. Let's talk about workplace culture, because this is really the juice of mental injury claims. We have situations like Deb experienced with PTSD. There's an acute situation that's really not avoidable, but a lot of mental health claims are not coming through this acute event. It's coming particularly from public sector. It's coming from organisational culture. There are many tools that you can use to measure your workplace culture. The People at Work survey has been developed by Queensland, dating back a long time, and they've done a wonderful job of it. This is another tool I'm talking about, the psychosocial safety climate. It's just one of many, but it's probably been the most widely researched tool. And so it kind of measures, it's a 12-question survey that kind of measures the culture at the workplace, including management commitment. And it can be used for risk assessment, benchmarking and planning, widely studied internationally, lead indicator. Next slide, thanks. And so this is some of the data from the return to work, so from the psychosocial climate data. So, for example, in this chart here, what you're looking at is organisations that have a high psychosocial safety climate culture, a good, positive culture, and return to work here on average is 8 days versus a poor culture, 52 days. So this is an organised, and prevention of psychosocial hazards is the current way we are talking about improving workplace culture. We've known about this for decades, but really haven't been tackling it well. And so if you're thinking about mental injury cases, we have to think more about prevention. They are difficult to manage, and if we ignore them, we have more physical injury claims, we have more mental health claims, and we have significantly slower return to work for both types of cases. Now, the psychosocial safety climate measures lots of things. If you work in the healthcare sector and you've got a good climate, your outcomes for your patients are better. We know this from local data and from UK data. So really important for a whole bunch of reasons. There's also lots of other benefits if you're talking to your bosses. So sickness absence is down, productivity is down, turnover of staff is down, all sorts of things are good spin-offs. We've known this now for a while, but it's just the challenge of how do we implement this and get the whole of the organisation on board with better systems. Thank you. Next slide. So psychosocial hazards. I want to talk a little bit about prevention and bringing psychosocial hazards and return to work together. So most of you will have been hearing about, I'd be interested to hear how actively you're involved in this, but, lots of psychosocial hazards. There are more in the public sector and less support in the public sector. Maybe that's why we're seeing more mental health claims from there. But there's, lots of them: low recognition, overwork, lack of role clarity, not feeling heard, not feeling supported, and, a lot of other things like remote work or traumatic work, like you're working in child protection, etc. Job demands you can't really manage. Thanks, next slide. And so really what we're looking at here is a spectrum of psychosocial stuff, if I could use that technical term, across prevention and return to work. And how about if we could get organisations thinking holistically about these things? Because at the moment, OH&S are very separate, or are quite separate, to the return to work teams. They might fall under HR. But if we can get HR, OH&S and return to work in organisations that are big enough to have these departments, we have a lot of opportunities because 1 and 1 makes 3 if you do it this way. And so if you've got good health and safety, you're going to have less physical cases. If you've got a good return to work culture, then you're going to have your return to work people feeding back to your OH&S people. So we're doing a better job with the prevention loop. And if the workplace culture is better, we're going to have a more welcoming environment. Prevention works better. You can share the data if you're working across the teams, and you can also tap into the key people at the workplace that are involved with both supervisors, senior managers, etc. You need them on board for both. So why not tackle both together? So if you are interested in going down that path, start to talk to your OH&S team, have some shared meetings, do some worksite evaluations together, prevention ones and return to work ones. Because prevention is better than cure, and it's 10 times better than trying to address the problem when it's become a full-blown issue. Next slide, thanks. So I'm going to talk a couple more specific things about mental health claims, and then go on to finish off just telling you a little bit about the policy at Pays to Care briefly. And then I think there should be nice time for questions, because that's often a great way of really bringing out your particular issues. I'm talking about things from my perspective, but, what are your particular issues? That's often valuable. So next slide, thanks. So key support principles. Sometimes people say, well, should we be in touch with them or should we leave them? Are we being intrusive? The thing is, just ask them. Say to people, look, I know you're going through a difficult time at the moment and we'd like to be in touch with you and kind of keep in touch. What works for you? Does getting in touch by phone, text, email work? If you've got any particular times of the day that work best or don't work best, give them your numbers so they can contact you. But really just offer them what works for them. People get the intent of where you're coming from, whatever awkward words we come out with. If you really care, that will come across. Just some simple things, active listening, easy to kind of be listening but not sounding like you're listening, particularly if there's lots going on around you. So full attention, don't interrupt, take notes, feedback. So gosh, I heard that what I understand you were saying is that this happened 3 weeks ago and you've spoken with your supervisor about these aggressive problems you've been dealing with in the workplace and nothing's been done. So you're acknowledging the person's issues, which is huge. We want that as people. Show empathy. You don't have to be anyone you're not. But, you know, I understand there were quite a few tears in Dr. Deb's presentation. You know, that's empathy. You're walking a mile in her shoes, and not everyone is as expressive as Dr. Deb. Some people are kind of, you know, they're not necessarily the best worker, or they're a bit of a pain in the neck at times to, you know, their colleagues think of them that way. But these are the ones we need to care for more because they might be struggling already. So supportive language, non-judgmental approach. Make sure you're meeting them. If you're going to meet with them in a quiet environment, there's no distractions. Do you want to meet with them at a local cafe, you know, online, phone? The more you can make it personal, the better. And keep in contact. Ask if they'd like a support person there. So really give them a lot of control. That's what's really important. Focus on what they can do. Explore what would help at work. Find out what would work for them. Kind of think about how you can be flexible but still productive. You want to make sure people are doing duties that are meaningful. So we don't want to hive them off into some little stuff that you know, is going through files or watching health and safety videos, as we see from time to time. It's demoralising. There's a psychosocial hazard in return to work. So think about those key support principles. Next slide. And do's and don'ts. It's not complicated. Maintain regular check-ins, document agreed actions, follow up. Not following up, not doing what you said you do is a sure way of losing trust. And when people are vulnerable, that can have a huge impact. And make sure you keep communications clear and simple. When people particularly have a lot of anxiety or their mood is very low, it can be hard for them to take things in. I personally see this more with anxiety, but, you know, keep it simple, put it in writing, make it clear. I was reading something this morning about 50% of Americans don't have a reading level to understand their medication on the front of their medication bottle, which was really a distressing statistic. I'm sure we're not as bad as that in Australia, but recognise that the level of health literacy across the country is still low. And so make things clear and simple. Don't give medical advice. Don't give your personal opinions. Don't make comparison to others, and don't breach confidentiality, because if there was ever something to make our mental health claim go off the rails, it is that. Next slide. And the next slide. Many of you will have heard about policy from the College of Physicians. That dreadful tickle at the back of my throat. There's some links there to it. If you have an interest in this area, I would encourage you to read it. 170 pages, long document, not a difficult read. Values and principles page accompanying paper to talk about the importance of values, trust, collaboration, health of the workers as priority. These things actually help workers and help employers. If we get these things right in the early stages, employers pay way less, they have much less hassle, and workers do better. Workers like being looked after, much more likely to come back to work. So contact details, if you haven't, next slide, thanks. If you haven't already, please follow us on LinkedIn. The LinkedIn profile provides a lot of nice infographics that you can use and share with others. And that Pays to Care website can keep you up to date with the various things that we're doing around the country. And there are many, from helping with making difficult things to say easier, to workshops for employers, to working with senior leaders, etc. And on that note, I think it's time to hand back to Lee Seaver and the WorkCover team.
Perfect. Thanks, Dr. Mary. And before we move on to questions, I might jump ahead a slide, Mary, to give you a chance to have some water and get rid of the tickle. I'll jump on to, I can see some great comments coming through in the chat around what resources are available. This has been a big focus for us recently here at WorkCover, is supporting our employer customers to support your workers. So we've got a bunch of new resources available. You'll get the links to all of these in the pack, and these are short videos. We've really tried and worked on making it information that's easy to share, easy to share with the direct supervisor who might be managing a worker who's off. So there's mental injury essentials. This covers kind of the basics of what is a mental injury. There's understanding mental injury claims, which really focuses on those primary mental injuries, and then there's a stream too around supporting the mental health of your workers with physical injuries. So we'll send around the links to those, and then we also have a bunch more information on our website, as well as the Safe Work Australia guide and the mentally healthy workplaces toolkit. So we'll send all of that around as part of the wrap up from today. But I just thought I would touch on those quickly, and now we will pop back to questions. Thanks, Elise. So we've had some really good questions come through both before and during the session. We'll get to as many as we can, but we might kick off with the first one. And what's the best way for an employer to support an injured worker through a mental injury while also addressing what might be a pre-existing condition that could be significantly impacting their recovery?
Pretty simple answer to that one, support them. So I get that that there's a lot of mental injury claims that have a big component from people's personal lives. People who have anxiety and depression, a history of anxiety and depression, are particularly vulnerable to mental injury claims, future mental injury claims. But really, if we try and tease out what's the current versus what's the pre-existing, we're going down a kind of a technical path that can take us away from that supportive approach. So my suggestion to you would be help the person, no matter what the previous issues were, help them. I had a meeting last week with another policymaker, and we were talking about physical injury claims as a part of a big workshop. You know, there's the question of what's pre-existing and what's the current. And really all of the evidence says if you focus on helping the person with whatever their problem is, you get the best outcome. Now, there may be important, valid liability questions that need to be addressed at some point. But that is the role of the insurer, not the employer. And so keep yourselves as employers separate to that. Focus on what you can do to help them. Physical injury case, mental injury case, the more you can do to get in early and help them, the better. Does that kind of answer the question? I'm not really tackling the pre-existing stuff.
No, I think so. I think so. And so do you have any tips on how to navigate performance conversations when a worker might have a mental health challenge? You know, it is, I think this is a great question. We all, you know, it's employers who have joined us today, and everyone has jobs to do and businesses to run. And so I think this is a really great question around that front.
Fantastic question, and a challenging issue to address. So there's a whole kind of body of work on helping employees report a mental health claim. But because it's hard, you know, there's all sorts of stigma involved. I guess there's two situations here. One is where there's a poor performance conversation and there's been no discussion about mental health challenges. And I think you've kind of got to, before you performance manage people, find out about their mental health. Like maybe you've had someone who's been a decent worker for 8 years and they're suddenly now not performing. Why aren't they performing? What's happened? Have they become depressed because of their personal life? Have they had some issue at work that's got them, is really intrusive now? I was going to almost use scatological language there, but I've refrained from that. So how can you kind of talk to them and find out? That might be a supervisor, HR, so get HR support. But, how you been going? I think you've been struggling a bit late. You've been coming in late, seen your work performance go off a bit worried about how you're going. Tell me. So that's a kind of, they haven't reported any mental health claims. And then if you've got the conversations about they have reported mental health claims and now there's some performance management, you kind of got to sort out whether it's the mental health or performance stuff or both. And that's not always easy. But the best approach is that collaboration. I've got a problem here with work. We're just not getting through the work. And I can see you're struggling getting through the work. I know you've had some mental health challenges in the past. Can we have a yarn about how much they're impacting you now and what we can do to support you with getting things back on track? So again, it's an engagement. You're giving them options. You're not judging them. You're giving them ample opportunity. Now, of course, you are going to have some naughty people in some organisations, and we have naughty providers and we have naughty workplaces. So there will be some naughtiness, and you've got to kind of get, yourself in the right space to recognise that small. The number of employers, supervisors we've heard say, oh, it's this problem from 36 years ago, or we know they're going through a divorce, or they had a car accident 24 years ago. It's so easy to put it onto other things, but we need to have that open conversation. If you don't think you have the capacity for that, find someone else who does, because it's not an easy convo, and you might be stumped. You might be like, I can't play these things. So get help. Get some coaching on it, practice role playing with others, or get help for somebody who's more skilled at it, but you've got to have the transparent conversation.
Thank you.
Hopefully that answers that.
Yeah, definitely. And you touched on this one a little bit before, but I think there's maybe a bit more here. And it's around, given that a worker can view the employer's response during the claims determination process, including if an employer disagrees with the version of events provided, how can we address those sensitivities when responding to a claim and maintain a supportive relationship with the worker, especially for cases involving a mental injury?
Yeah, so, I've been off work for a week after what for me was some pretty awful approaches from my line manager. And my line manager says, I'm a pain in the neck and I'm going through all sorts of other stuff in my life, and doesn't think it's a claim and a work issue, and then that gets passed on, and somehow that information then filters through to the employee versus sharing of paperwork or apps or whatever. And that can look pretty bad. So you've got to be cautious about it. Again, it comes back to this whole transparency and collaboration. It's hard to have difficult conversations. Think about how to have those difficult conversations. But, if you're going to put something in writing like that, I think you want to be talking to the worker about it. So, somebody's lodged a mental health claim for bullying in an office of 20 people. And you've got concerns because their behaviour hasn't been ideal. Maybe they're part of the problem. You need to, I shouldn't say you need, because you don't need to do anything. It's just that it's going to have better results if you talk to me about it. I'm that person in the office and I've really been pissed off with this person who's giving me a hard time. Sit down with me and say, if it's reasonable management action, say, look, I get your frustration and I get that hasn't gone so well, but really this is an important issue for performance for us to address, and we need to be doing that. And so you're giving the person forewarning. It's going to be in the paperwork. You'll see it. We don't want to get into a fight with you, but we just need the insurer to have all the information so that the claim can be determined appropriately. Regardless of how the claim goes, we want to support you, and then start the discussions about what they can do at work, even if they don't have a claim. Bring them in, engage with them.
Seems to be a recurring theme. Have the conversation and open and transparency. And one we often talk to here in our determinations team is really stick to the facts. Stick with the facts and remove that the layer of emotion from the documentation that you provide.
That is excellent point. Thank you. Absolutely. Don't just keep to the facts.
We have had more questions come through, but I am conscious of time, so I think that is all we have time for today. Apologies if we haven't gotten to your question. Thank you for coming along. We will share the recording and the slides. And a very big thank you to you, Dr. Mary, for joining us today.
Thanks to everyone for joining.